And talking about solutions, you've mentioned the idea of sustainability. When you say sustainability in the context of the work that you do, what do you mean? What is it that needs to be done to ensure sustainability of what advocacy of policies, sustainabilities of access? What are you talking about when you say sustainability?
So most people, when they say sustainability, they think about money, they think about finances, and that's a big part of the conversation. Let me get there in a minute. The first part is obviously, we and I think about it as how do we sustain the gains that we have made? And how do we put the right systems in place to ensure that we sustain the programming that is necessary? And importantly, how to sustain the political will, and that's at country level, right? To keep on ensuring that the right things are happening for all people. And then thirdly, it's about finances. So we've been working for the last 10, 12, 11 months, especially with PEPFAR, with the US government, but also with the Global Fund, to work with countries, about 30 countries, to help them think about what does a sustainability roadmap looks like for us? How do we sustain this programmatic, political, and financial sustainability? And, people often think that, all the money in the world for HIV comes from donors. It doesn't. About 60% of funding comes from countries themselves. But there is that big gap that is still paid by the outside world. And we need to figure out how do countries incrementally take over those costs. And very implicit in that conversation is a conversation around how do we increasingly integrate HIV into broader health programs, right? And I find that interesting. Sorry, but maybe because you're sitting in front of me, but I obviously my biggest reference point is Botswana. So thinking about how do you integrate HIV services into a health system that is quite fragile. And it's probably one of the better health systems we have on the continent, but it is fragile. Yeah. And it needs work. And often HIV services have become much better resource services, right? Now you're saying those services, you either put them at the level of the primary health services that are not so great, or you must figure out how do you lift the other health services to a standard that it feels okay to bring the HIV services in there. And I think that's the better option. And I think most people think that way. But what you also need to think about, and that's the trickier part, even in Botswana, how do you make sure that when there is possibly less or no outside intervention or financial support, how do you make sure that those most marginalized will be served? And that might be because of geography. In some countries, geographies are very difficult, but it might also be because you're a drug user, or you're a gay man, or you're a transgender woman, or you are a sex worker. And those populations very often are not the first populations to be served by their own governments. Coming back to the Jamaica example, it is harder for Jamaica, even with a very determined and committed Ministry of Health, to think about how are we going to serve those populations, which in their case will be mainly from key populations. So this is how we're thinking about sustainability. I think some countries are doing really well thinking about it. I think the biggest challenge we have is this issue about how do we ensure in whatever we are integrating and however we're going to do that, we protect the human rights approach, this person-centered approach, but also how do we protect those most marginalized? And I think communities and civil society are the ones most worried and most anxious about this conversation about sustainability, because for most people, it sounds like donors are saying we're on our way out. We've done our bit, so we step back. And there's possibly some of that in there. But if that is the case, no matter what is the case and no matter what the motivation behind it is, like I said at the beginning, I think most governments do want to look after their own populations, and we need to help. That's one of the reasons why we exist as the UN, to figure out how do you do that in a way that is palatable, but also importantly, even if you don't believe in inclusion and so forth, but you know that you will have resurgence of epidemics if you are not looking at all people in all geographies.